Question 1. Which of the following best describes the primary purpose of the Health Insurance Portability and Accountability Act, HIPAA? Privacy rule? A. To prevent healthcare fraud and abuse. B. To ensure all Americans have access to health insurance. C. To protect the privacy of individually identifiable health information. D. To standardize electronic data interchange for healthcare transactions. Answer: C. To protect the privacy of individually identifiable health information. This question tests your understanding of HIPAA, specifically the privacy rule. The key phrase, primary purpose, directs you to the core function of this rule. The HIPAA privacy rule sets national standards to protect individuals' medical records and other personal health information, PHI, ensuring that healthcare providers and other covered entities handle this data responsibly. For example, it dictates who can access patient charts and under what circumstances, such as requiring a patient's consent before sharing their medical history for marketing purposes. This rule helps maintain patient trust and confidentiality in the healthcare system. Question 2. A physician refers a Medicare patient to a clinical laboratory in which the physician has a financial interest. This scenario is most likely a violation of which of the following? A. Anti-kickback statute. B. False Claims Act. C. Stark Law. D. HIPAA security rule. Answer: C. Stark Law. This question focuses on the Stark Law, with the keywords physician, financial interest, and referral being crucial clues. The Stark Law, also known as the Physician Self-Referral Law, prohibits physicians from referring Medicare or Medicaid patients to entities for certain designated health services if the physician, or an immediate family member, has a financial relationship with that entity. Its purpose is to prevent conflicts of interest that could influence a physician's medical decisions based on financial gain rather than patient needs. Remember, the Stark Law specifically addresses financial relationships and referrals for designated health services. Question 3. What is the main purpose of an Advance Beneficiary Notice of Non-Coverage, ABN? A. To inform patients of their financial responsibility for services Medicare is not expected to cover. B. To notify Medicare that a service provided was medically necessary. C. To obtain patient consent for a surgical procedure. D. To document a patient's refusal of treatment. Answer: A. To inform patients of their financial responsibility for services Medicare is not expected to cover. This question is about the Advance Beneficiary Notice, ABN, and the key is understanding its primary function in the context of Medicare. An ABN is a written notice that a healthcare provider gives to a Medicare beneficiary before providing services or items that Medicare may not pay for. This ensures the patient is aware that they might be financially responsible for the service if Medicare denies coverage. For instance, if a physician believes a specific test is not medically necessary per Medicare guidelines, an ABN is used to inform the patient and get their agreement to pay if Medicare doesn't. Always remember that an ABN is about informing Medicare patients of potential non-coverage and their financial liability. Question 4. Which of the following is considered an example of healthcare fraud? A. Billing for a higher level of service than actually provided. B. Submitting claims with incorrect codes due to a clerical error. C. Performing medically unnecessary services due to poor judgment. D. Forgetting to obtain an ABN for a non-covered service. Answer: A. Billing for a higher level of service than actually provided. This question distinguishes between healthcare fraud and abuse. The crucial element to identify fraud is intentional deception for financial gain. Billing for a higher level of service than was actually performed or documented, often called upcoding, is a classic example because it involves deliberately misrepresenting the services to receive greater reimbursement. Unintentional errors or poor judgment typically fall under abuse, but the deliberate act of upcoding signifies fraudulent intent. Remember that fraud involves purposeful misrepresentation, while abuse often stems from careless or inconsistent practices. Question 5. The OIG work plan outlines areas of focus for investigations and audits. What does OIG stand for? A. Office of Internal Grievances. B. Office of Inspector General. C. Oversight and Implementation Group. D. Organization of Integrated Governance. Answer: B. Office of Inspector General. This question tests your knowledge of common acronyms in healthcare compliance, specifically OIG. The OIG, or Office of Inspector General, is a federal agency within the Department of Health and Human Services, HHS, responsible for combating fraud, waste, and abuse in Medicare, Medicaid, and other HHS programs. The OIG Work Plan is a publicly available document that identifies the specific areas that the OIG intends to focus on during its audits and investigations in the coming year. Knowing what the OIG is and its role is fundamental for understanding compliance efforts. Question 6. A hospital performs a medical screening examination on every individual who comes to the emergency department, regardless of their ability to pay. This practice aligns with the requirements of which regulation? A. HIPAA Privacy Rule. B. Emergency Medical Treatment and Labor Act, EMTLA. C. Clinical Laboratory Improvement Amendments, CLIA. D. False Claims Act. Answer: B. Emergency Medical Treatment and Labor Act, EMTLA. This question addresses the Emergency Medical Treatment and Labor Act, EMTLA, with the key phrases emergency department, medical screening examination, and ability to pay highlighting its purpose. EMTLA requires hospitals that participate in Medicare to provide a medical screening examination to any individual who comes to the emergency department seeking examination or treatment for a medical condition. If an emergency medical condition exists, the hospital must provide stabilizing treatment or an appropriate transfer, regardless of the patient's insurance status or ability to pay. This law ensures access to emergency care for everyone. Question 7. What is the primary purpose of the National Correct Coding Initiative, NCCI, edits? A. To ensure accurate and appropriate medical record documentation. B. To prevent improper payment when incorrect code combinations are reported. C. To establish fair market value for healthcare services. D. To identify patterns of healthcare fraud and abuse across the nation. Answer: B. To prevent improper payment when incorrect code combinations are reported. This question focuses on the National Correct Coding Initiative, NCCI, edits, and the keywords incorrect code combinations and prevent improper payment are vital clues. The NCCI was developed by CMS to promote national correct coding methodologies and to control improper coding leading to inappropriate payment of Part B claims. These edits identify codes that should not be billed together, either because one service is integral to the other or because they are mutually exclusive, and indicate when modifiers can be used to bypass these edits if clinically appropriate. Understanding NCCI helps coders prevent common billing errors and ensure accurate reimbursement. Question 8. A comprehensive corporate compliance plan should include which of the following elements? A. Exclusively focus on financial auditing. B. Designate a compliance officer or committee. C. Only address federal regulations, not state laws. D. Be a one-time process with no updates. Answer B. Designate a compliance officer or committee. This question tests your knowledge of the essential components of an effective corporate compliance plan. A robust compliance plan, as recommended by the OIG, typically includes 7 fundamental elements, and designating a compliance officer or committee is a cornerstone. This individual or group is responsible for overseeing the plan, ensuring its implementation, and serving as a focal point for compliance issues within the organization. A good compliance plan is a dynamic, ongoing process that incorporates training, auditing, monitoring, and regular updates to address both federal and state regulations. Question 9. Under the False Claims Act, a CATAM lawsuit allows which of the following? A. The government to directly sue healthcare providers for negligence. B. An individual to file a lawsuit on behalf of the government for false claims. C. Healthcare organizations to appeal Medicare audit findings. D. Providers to self-disclose billing errors without penalty. Answer B. An individual to file a lawsuit on behalf of the government for false claims. This question introduces the concept of a CATAM lawsuit under the False Claims Act. The term CATAM literally means who is well for the king as for himself, and it refers to the provision that allows a private citizen, known as a relator or whistleblower, to bring a lawsuit on behalf of the U.S. government. If the lawsuit is successful, the relator typically receives a share of the recovered funds. This provision encourages individuals with knowledge of fraud against the government to come forward and report it. Question 10. When should a coder apply modifier 25 to an evaluation and management E/M service? A. When the E/M service resulted in a decision for surgery. B. When the E/M service is distinct from a separately identifiable procedure performed on the same day. C. When the E/M service is performed by a different physician in the same group. D. When the E/M service is performed in an emergency department setting. Answer B. When the E/M service is distinct from a separately identifiable procedure performed on the same day. This question focuses on the appropriate use of modifier 25, which is a common area for compliance questions. Modifier 25 indicates that a significant, separately identifiable evaluation and management E/M service was performed on the same date as another procedure or service. This means the E/M service was not routine pre- or post-procedure work but required distinct physician effort and decision-making beyond what is typical for the procedure itself. For example, if a patient comes in for a mole removal procedure, but during the same visit, the physician also evaluates and manages a new, unrelated skin rash, significant E/M service, modifier 25 would be appended to the E/M code. Always remember that modifier 25 signifies a separate, significant E/M service performed on the same day as another procedure. Question 11. What is the primary purpose of the Anti-kickback statute, AKS? A. To prohibit physicians from referring patients to entities in which they have a financial interest. B. To prevent the exchange of anything of value to induce or reward referrals for federal healthcare program business. C. To regulate the privacy and security of patient health information. D. To standardize the electronic transmission of healthcare claims. Answer B. To prevent the exchange of anything of value to induce or reward referrals for federal healthcare program business. This question is about the Anti-kickback statute, AKS, and the critical clues are anything of value, induce or reward, and referrals. The AKS makes it a criminal offense to knowingly and willfully offer, pay, solicit, or receive any remuneration, anything of value, to induce or reward referrals or generate business reimbursable by federal healthcare programs like Medicare and Medicaid. Its purpose is to ensure that medical decisions are made solely based on the patient's best interests, free from financial incentives. Unlike the Stark Law, which is a civil statute focusing on physician self-referrals, the AKS targets a broader range of illicit transactions designed to influence healthcare decisions. Question 12. Medical necessity for a service is best defined as A. Any service requested by the patient. B. Services that are reasonable and necessary for the diagnosis or treatment of illness or injury. C. Services that are covered by the patient's insurance plan. D. Services that are routinely performed in a specific specialty. Answer: B. Services that are reasonable and necessary for the diagnosis or treatment of illness or injury. This question asks for the definition of medical necessity, a foundational concept in medical coding and billing compliance. Medical necessity generally refers to healthcare services that a prudent physician would provide to a patient for the purpose of diagnosing or treating an illness, injury, condition, disease, or its symptoms, in accordance with generally accepted standards of medical practice. Simply put, services must be appropriate for the patient's condition and meet accepted clinical guidelines. Services that are not medically necessary, even if requested by the patient or covered by insurance, are generally not reimbursable by federal payers. Question 13. Which act expanded the scope of HIPAA and strengthened its enforcement provisions, particularly concerning breaches of protected health information, PHI? A. Social Security Act. B. Affordable Care Act, ACA. C. Health Information Technology for Economic and Clinical Health, HITECH Act. D. Consolidated Omnibus Budget Reconciliation Act, COBRA. Answer: C. Health Information Technology for Economic and Clinical Health, HITECH Act. This question focuses on the HITECH Act and its relationship to HIPAA, with keywords like expanded scope, strengthened enforcement, and breaches of PHI pointing to its core impact. The HITECH Act, enacted as part of the American Recovery and Reinvestment Act of 2009, significantly reinforced the HIPAA privacy and security rules. It mandated breach notification requirements, increased penalties for HIPAA violations, and extended HIPAA's direct applicability to business associates. HITECH was pivotal in modernizing healthcare data protection in the digital age. Question 14. A medical practice fails to document the medical necessity for services billed to Medicare, resulting in overpayments. This scenario is most likely an example of A. Healthcare fraud. B. Healthcare abuse. C. CATAM violation. D. Stark Law violation. Answer: B. Healthcare abuse. This question requires you to differentiate between fraud and abuse. The key phrase "fails to document the medical necessity" points to a problem with practice or process rather than intentional deception. Healthcare abuse involves practices that, either directly or indirectly, result in unnecessary costs to the healthcare system, often due to carelessness, inefficiency, or poor administrative practices, without necessarily involving intentional misrepresentation. While inadequate documentation could lead to overpayment, if there's no evidence of intent to defraud, it is typically classified as abuse. Remember, abuse lacks the specific intent to deceive that characterizes fraud. Question 15. What is the general recommended record retention period for adult patient medical records in most states? A. 1 to 2 years. B. 3 to 5 years. C. 7 to 10 years. D. 15 to 20 years. Answer C. 7 to 10 years. This question addresses the important compliance topic of medical record retention. While specific requirements can vary by state and payer, a common general guideline for retaining adult patient medical records is 7 to 10 years. This time frame helps ensure that records are available for continuity of care, legal proceedings, audits, and research, aligning with various state statutes of limitations and federal program requirements. Always verify the specific retention laws in your state and for any particular federal programs you bill, as these can sometimes be longer. Question 16. Services provided by a non-physician practitioner, NPP, such as a physician assistant, PA, or nurse practitioner, NP, can be billed incident to a physician's services if certain criteria are met. Which of the following is a key requirement for incident to billing? A. The NPP must have a separate NPI number. B. The patient must be new to the practice. C. The physician must be physically present in the office suite and immediately available. D. The services must be provided in a hospital inpatient setting. Answer C. The physician must be physically present in the office suite and immediately available. This question tests your understanding of incident to billing, a specific Medicare guideline for services provided by non-physician practitioners. The critical requirement for incident to billing is that the supervising physician must be physically present in the office suite, available to provide immediate assistance and direct supervision, though not necessarily in the same room. This allows the services to be billed under the physician's NPI and reimbursed at 100% of the physician fee schedule amount, rather than the NPP's NPI at 85%. This billing method is generally restricted to the office or clinic setting and applies to established patients receiving follow-up care for a condition the physician initially treated. Question 17. The Clinical Laboratory Improvement Amendments, CLIA, regulate which aspect of healthcare? A. Quality standards for all laboratory testing. B. Physician self-referrals to laboratories. C. Electronic health record system requirements. D. Patient privacy in laboratory settings. Answer A. Quality standards for all laboratory testing. This question focuses on the Clinical Laboratory Improvement Amendments, CLIA, with the keyword laboratory testing being the primary clue. CLIA establishes quality standards for all laboratory testing performed on human specimens in the United States, except for research purposes. Its goal is to ensure the accuracy, reliability, and timeliness of patient test results regardless of where the test was performed. CLIA regulations specify requirements for personnel qualifications, quality control, proficiency testing, and patient test management, among others. Question 18. What is the primary role of a designated compliance officer within a healthcare organization? A. To oversee all clinical operations and patient care. B. To manage the organization's financial investments. C. To develop, implement, and monitor the organization's compliance program. D. To handle all patient billing and collections. Answer C. To develop, implement, and monitor the organization's compliance program. This question highlights the central role of a compliance officer in a healthcare organization. The compliance officer is a crucial figure responsible for guiding the organization in adhering to complex healthcare laws, regulations, and ethical standards. Their duties typically involve developing compliance policies, providing staff training, conducting internal audits, investigating potential violations, and ensuring corrective actions are taken. This role is essential for maintaining integrity and preventing fraud and abuse within the organization. Question 19. If a physician regularly waives copayments for certain patients without any established financial hardship policy, this practice could be considered a violation of A. HIPAA Privacy Rule, B. False Claims Act, C. Anti-kickback statute, D. Stark Law. Answer, C. Anti-kickback statute. This question describes a scenario that touches on compliance with the anti-kickback statute, especially regarding waivers of copayments. Routinely waiving copayments or deductibles without a legitimate assessment of financial hardship could be construed as offering an illegal inducement to beneficiaries of federal healthcare programs, like Medicare or Medicaid. This is because it might encourage patients to utilize services from that provider, potentially leading to inflated claims or unnecessary services, thereby violating the anti-kickback statute by inducing referrals. Always be cautious with blanket waivers of patient financial responsibility, as they can have serious compliance implications. Question 20. What is the fundamental concept behind the red flag rules? A. To identify and prevent healthcare fraud schemes. B. To detect, prevent, and mitigate identity theft. C. To ensure appropriate use of durable medical equipment. D. To regulate the disposal of medical waste. Answer, B. To detect, prevent, and mitigate identity theft. This question addresses the red flag rules, and the key concept is identity theft. The red flag rules, mandated by the Fair and Accurate Credit Transactions Act, FACTA, require certain creditors, including many healthcare providers, to develop and implement written programs to detect, prevent, and mitigate identity theft. This involves identifying red flags, suspicious patterns or practices that could indicate identity theft, and taking appropriate action to address them. For example, a red flag might be an invalid insurance card or inconsistent demographic information from a patient. Question 21. Which type of audit typically focuses on the accuracy of coding and billing for services provided? A. Financial audit. B. Clinical audit. C. Compliance audit. D. Research audit. Answer, C. Compliance audit. This question asks about the type of audit specifically focused on coding and billing accuracy. A compliance audit systematically reviews an organization's adherence to relevant laws, regulations, and internal policies, particularly concerning documentation, coding, and billing practices. These audits aim to identify potential risks, errors, and areas of non-compliance to prevent fraud, waste, and abuse. Unlike a purely financial audit or a clinical audit focusing solely on patient outcomes, a compliance audit specifically evaluates whether the services provided are accurately documented and billed according to established rules. Question 22. When a provider bills for services that were never actually rendered, this is a clear example of A. Upcoding. B. Unbundling. C. Fraud. D. Abuse. Answer, C. Fraud. This question presents a very clear scenario of healthcare fraud. The keyword never actually rendered indicates a deliberate act of deception with the intent to obtain payment for services that did not occur. This is not merely an error or a coding mistake but a direct misrepresentation designed for financial gain, which is the definition of fraud. It's important to distinguish this from abuse, which typically involves practices inconsistent with sound medical or business practices, but without the intent to deceive. Question 23. A medical record should accurately reflect the services provided to justify the code submitted for reimbursement. This principle primarily supports which coding concept? A. Linkage. B. Medical necessity. C. Bundling. D. Upcoding. Answer B. Medical necessity. This question emphasizes the crucial link between documentation and medical necessity for reimbursement. The phrase "accurately reflect the services provided to justify the code submitted" directly refers to the requirement that the documentation in the medical record must support the medical necessity of the services. Payers, especially federal programs, require documentation to demonstrate that services were reasonable, necessary, and appropriate for the patient's condition according to accepted standards of care. Without adequate documentation of medical necessity, claims can be denied, even if the service was technically performed. Question 24. What is the most significant consequence for a healthcare provider found guilty of violating the False Claims Act? A. Only a warning and mandatory compliance training. B. Exclusion from participation in federal healthcare programs. C. A minor administrative fine. D. Mandatory peer review for a limited period. Answer B. Exclusion from participation in federal healthcare programs. This question addresses the severe consequences of violating the False Claims Act. While monetary penalties are significant, one of the most impactful consequences for a healthcare provider or organization found guilty of violating the False Claims Act is exclusion from participation in federal healthcare programs, such as Medicare and Medicaid. This means they would no longer be able to bill for services provided to beneficiaries of these programs, which can effectively end a healthcare business. This harsh penalty underscores the government's commitment to preventing fraud against federal programs. Question 25. Which of the following best describes the practice of unbundling in medical coding? A. Billing for a higher level of service than documented. B. Separately reporting services that are typically considered components of a more comprehensive procedure. C. Performing medically unnecessary services to generate more claims. D. Billing for services provided by an unsupervised non-physician practitioner. Answer B. Separately reporting services that are typically considered components of a more comprehensive procedure. This question defines unbundling, a common compliance issue in medical coding. Unbundling occurs when a provider bills separately for individual components of a service that should legitimately be combined and billed as a single, more comprehensive procedure code. For example, if a surgical code includes a standard approach, closure, and specific intraoperative services, it would be unbundling to bill for these individual components in addition to the comprehensive surgical code. This practice can lead to overpayment and is closely monitored by NCCI audits to ensure correct coding.